I'm Dr. Esther Kawira, and I'm 60 years old. I'm the medical director for the SHED Foundation. SHED, S-H-E-D, is an acronym. It stands for Shirati Health, Education, and Development Foundation. And we, when I say we, a few of us like-minded individuals who live here in Shirati decided that we needed an organization under which humanitarian work could be carried out.
Most of these jobs people do, they do it for money. Like you have to be paid to do something. When we started SHED and we had guests, we used to go to the lake to get some water on trucks, even at night, so our guests could be comfortable. So the commitment became so strong, there was no money coming in, just we were volunteers, and we are still volunteers. We love this country, we like to see the country growing and people being committed to what they are doing, which many people don't. And the other thing was we found a compatible team. You see my brother and his wife are very, very committed. Esther is very committed as a medical doctor. And Joe Magati, the general secretary too, he had to stop being a general secretary of the church because of his commitment to SHED. And I retired too from the church. And after doing that, I joined the SHED, and we all became one body.
Village Life is a Cincinnati-based nonprofit organization that partners with villages in Tanzania, East Africa, to improve conditions of life, health, and education. So my first month here in the Shirati region, I worked at Shirati Hospital. And during that month, I had lived with Dr. Esther and her husband Josiah and been exposed to many of the SHED directors before there was a SHED. It was basically just a group of people who lived there that were working in the hospital and really had this interest in helping develop this region. But it was before that they had actually incorporated their own Tanzanian NGO. Once they did a couple of years into Village Life's participation in this region, it really helped us out a lot in terms of being able to oversee staff, develop relationships with the communities here, and they're integral to our on-the-ground operations here in Tanzania. We couldn't really do anything without SHED. They're our number one partner.
There aren't these kind of organizations often in rural areas. Sometimes they're more in the cities, or it's only under the church that humanitarian work and evangelism is done. So that was what motivated us to start the SHED Foundation, to get it registered within Tanzania.
About 200 students have now gone through SHED. They come and go. Some are medical, some are engineers and whatever. And we have enjoyed meeting all these people over the 6 years.